Hi everyone, and welcome to our Facebook Live. I'm Kristen Hewitt here at Joe DiMaggio Children's Hospital for a very special event called Lunch with Lena. We are so excited to bring you this today because schools are reopening. They've reopened in Palm Beach County, they're reopening in Dade County, and now Broward County is gearing up to open their doors and bring in kids. And we want to keep kids, teachers, administrators, grandparents, parents, everyone safe and bring you the tips, you the community, the tips you need to keep your kids safe. And the person that's going to do that is going to come on in here now, Lena Puntervolt. She's the infection control practitioner here at Joe DiMaggio Children's Hospital. Lena, thank you for doing this.
Thank you. Thank you for having me.
Of course.
Hi, everyone.
All right, and we guys, please give us your comments, give us your questions. We'll be reading those to you. We'll be answering those today. And I want to start off, Lena, first of all, with what is an infection control practitioner? What does that mean?
Infection preventionists are all found in the hospitals. We are kind of the eyes and ears for what the healthcare workers and our visitors and our patients need to do to make sure that we all are infection-free. We are the educators when it comes to infection prevention. We educate our staff, we educate our patients in what those things are. We also investigate infection patterns within the facility. We work together to put together policies and procedures, and we work very closely with the local and state health departments.
Okay, Lena, as we gear up to open schools, I know that you have a ton of tips for parents. So I want to get to those because they were very helpful to me. Again, I'm a parenting writer, I'm a parent, and I want to know how to keep my kids if they're going to return to school. So we're wearing our masks for a reason because we're in close proximity to bring you this broadcast. So what is your first tip about getting kids acclimated to wearing masks all day at school?
So masks are what we've recommended, from the guidance of the CDC as a barrier, making sure I'm keeping my droplets to myself and that Kristen's keeping her droplets to herself. It's really important, as a healthcare professional, I can attest to, yes, I am comfortable with wearing a mask, but it was definitely a learning curve for myself and my peers wearing it from an extended period of time. So what I encourage you guys to do now, before your little ones and your children go to school, is perhaps have them wear it at home for an extended period of time. I know we've been doing this for a couple months, wearing our masks, maybe going to the grocery store, to Target, but it's one thing to wear it for 30 minutes, and then there's another thing when you wear it for a long time. You have a tendency to want to fidget, want to readjust your mask. So those are the times when you have the mask at home, you can then watch and observe your child. What are they going to do? Are they going to touch their mask? And if they are, gently redirect them and explain the why. If they, for whatever reason, feel like they want to readjust it, that's the opportunity for them to go ahead and tell them, wash your hands if you have a sink available, or use hand sanitizer, sanitize your hands, and then make sure you adjust your mask. Never touching the front, always touching this to the sides so that you make sure that you can adjust it and you don't contaminate your hand.
Okay, and I want to bring up a point because Lena's going to laugh at me, but yesterday I had a shoot. Now come in here. Yesterday I had a shoot and I had to wear this for 8 to 10 straight hours. And Lena, it hurt the back of my ears. And I know that you had to get used to wearing a mask 10 to 12 hours now during COVID, but we have to be having our children wear those masks because they're going to feel that. So there are things you can do, right, if your kids are having a hard time wearing the mask or having pain behind the ear.
Well, with these last 7 months, I have, a lot of my healthcare colleagues have realized that not all masks are created equal. Some of them, may tug at the back of the ears. Some may tickle the nose. Some just don't give you that good seal. So another reason for you to want to consider having your child wear the mask while they're at home is to see what mask did you buy, and is that one working for them? Are they going to find themselves fidgeting? Are they complaining that it's affecting the back of their ears? And then troubleshoot. Do you need to make it longer? Do you need to make it shorter? Do you need to do all those things to kind of make sure that they're able to comfortably wear their mask and be successful when they're in school?
Okay, so one of the things Lena just brought up to everyone is if your child is touching the mask, we obviously have to redirect them, but how to take off your mask. And I know you talked about it, but I want you to show people without taking your mask off completely how to teach your children how to properly take their mask off at school. Where do the kids put the mask when they're at school to eat lunch or go to the bathroom or whatever it is they need to do, and how do they put it back on safely? So here's some hand sanitizer.
Okay.
Go ahead.
Okay, so one of the things that there's going to be a time where they're going to have to take off their mask, and that's when they're going to eat. So I encourage you to, talk this through with your child, that when that lunchtime comes, get an extra sheet of a clean paper towel. If you're packing a lunch for your child, perhaps consider taking a napkin, an extra napkin for that mask. So what you're going to do is you're going to encourage your child to sanitize their hands. Make sure when you're sanitizing your hands, it's not only about the bottoms, but the tops, in between the fingers, the thumbs, and you make sure that you do that until you've got all the coverage of your hands. And then we don't touch this. We touch the ear loops, and then you make sure that this part of the mask is what's laying against the paper towel, and the inside is facing up. And it's nice and clean and away from your space. Make sure that the child, when you talk to your children, that they know that they're going to be within 6 feet of each other so that they can safely put their masks to the side. They can eat, and once they're done eating, they can go ahead, sanitize their hands, and then again, put the mask on.
Okay, and so you could do that with a paper towel. You could use a Ziploc bag to put your mask in perhaps during lunch. But the point is you don't want that mask to be on a surface that could be tainted with the germs. Okay, another great thing, you guys, that I learned from Lena is school supplies. Our school supply list as we return to school. I know we all haven't shopped for school supplies yet because everything's so crazy. Chantel says that she suggests they place their mask in a Ziploc bag. That's exactly what we just said, Chantel, and that's a great tip. So what kind of school supplies do we need? Because I have a feeling that masks may get lost. If any of these kids are like my kids, they might lose their mask, they might drop it in a toilet. I don't know. Things are going to happen at school. So what do we need returning to school in terms of school supplies?
So the mask is going to be, think of it like an extension of their school wear. They're going to have to wear that mask. So definitely I would consider possibly packing another mask in a Ziploc bag for your child. Remember, they're going to be at school. This is something that is a requirement. They're going to have to wear the mask. They may be at recess. They may be at PE, whatever that looks like for their school, so they can get sweaty. So, you want to make sure you have that mask available for them. Things happen. They may fall. They may just want a fresh mask. So again, a mask would be great. Hand sanitizer for those children that understand and know how to properly use and safely use hand sanitizer is definitely a good idea. Perhaps if you're packing a lunch again, having one in the lunch box and then having one in a backpack. And then also, I do get sometimes complaints that especially now with COVID, we're washing our hands quite frequently. We're also using a lot of hand sanitizer. Getting some kind of moisturizer if you want for your older kids would be, because it's all about hand hygiene, right? It's not only about making sure that you're washing your hands correctly, but it's also making sure that we're keeping them nice and healthy. Hands are nice and intact, so you want to make sure that they don't get overly dry. So perhaps getting like a nice small bottle of moisturizer for their hands as well.
Okay, that's a great tip as well. Okay, so I know a lot of healthcare workers, when they come home after working on COVID floors, perhaps they have a routine of how they get out of their clothes and what they do with their masks. So in terms of cloth masks, and we did have a great question about are there certain masks that shouldn't be used or that are not as effective? But from what I've read, triple layer cloth masks are great, N95s. This is a KN95 I'm wearing. I know you have a thick cloth mask. But what are we doing with the masks? How often are we washing them? What's our protocol when we come home for laundering and taking care of these masks?
So the one thing that you did mention, Kristen, was the cloth masks. Make sure that they are multi-layer. I do see a lot of those gator masks, and they tend to be thin. So if that's something that you opt to do, make sure that you fold it so it's multiple layers and it's not that single layer. But we definitely encourage more of your cloth masks and your other masks, like she mentioned, the K95.
This is a triple layer.
Yeah, that's a triple layer.
That one.
This is a triple layer mask, and it's nice and thick. Okay, the CDC recommends that we launder our masks daily. I don't know the practicality of that at your household, but then, I want you to make sure that you think about, do you have 5 uniform tops? Do you need 5 masks? And remember that you want to pack an extra one. So do you want to, have a certain supply, because you have to launder them, and you want to make sure that you want to capture and remember that you have to launder them. So where do you want your child to place it? Do you want them to place it in a laundry basket, or do you want to have a smaller basket, by the sink, so when they come home, they wash their hands, and then they remove their mask, and it's in a basket, and then, you remember you need to take it, and you need to wash it. So those are things that you may want to walk through, and remember what your day-to-day will look like.
Yeah. Another thing that Lena told me that is both something I love and hate is we have to teach our kids what transmission means, because a lot of kids, especially younger, preschool, kindergarten, first grade, don't understand transmission and germs. So Lena has a great experiment that you can do to teach transmission with your kids. And I will warn you, I did this with another substance. I did this with baby powder because I don't love what Lena's going to tell you, but it works. So hold on, Lena, tell everybody what I'm talking about.
So it's really important for us to understand the whys behind this. So glitter. I know some people have a strong aversion to glitter because it gets everywhere, but case in point, germs get everywhere. So it's really important. So what you can do is pick a device, something that your kids really love, whether it's their iPads, their phones, their gamers, or remote controls, or just the TV remote control. Dab a little bit of glitter, and then, just place it there. And see, if your child touches it, when your child touches it, give yourself a time frame. Some may take 10 minutes, some may take 20, depending on how you don't like or you do like glitter. And then take that moment once, you've seen that they've done some movement around the house, or even just within that time frame that they're on their device, and then stop and show them exactly where all the glitter is. As we know, glitter gets everywhere. And that's your teachable moment. This is why we wash our hands. This is why we disinfect things. This is why we wear our masks. Because just as easily as that glitter got around to all the surfaces, germs transmit just as easily.
Lena, I think that that's a great experiment for teachers to do with their kids when they return to school. So I'm going to suggest that everybody, all the science teachers in the world, do that when the kids come back, because I'm going to let the teachers do that. But that is a great one. We just had a great comment in the comments. Leslie asked Lena, what about air purifiers? How effective are those in the classroom? We use Hepa air filters because we have allergies in pets, and they are very effective for filtering out pet hair and pet dander. But do we have any research on Hepa or any type of air purifiers eliminating germs in the classroom?
So when it comes to air purifiers, when it comes to Hepa, here in the hospital we may find that sometimes there is a need to use that, but that's because we're providing patient care, and we may be generating and aerosolizing particles and droplets within the environment. When we think about the school, it's really important for us to just simply take note that our children should be going to school when they're healthy and they're well. We also have the mask. The mask is source control. It is that barrier that will help us make sure that if I may be cooking, something's cooking and I'm getting sick, but I'm not showing symptoms, my droplets are going to stay to me. And if somebody, my neighbor or somebody else is in my classroom and they be coming down with some sniffles, again, their droplets stay with them. So while there may be benefits in different settings or for different reasons, I think for schools, the key thing is if you're not feeling well, if you're suspecting that your child's not well, they really need to stay home, because that's really what's going to help with any potential transmission of this organism.
Great. I know you talked a lot about having a place to put the masks for laundering and have a system and procedures in place, but school is going to look different for kids as they return. That's not to say it's what they're doing, keeping kids in classrooms or limiting movement, is wrong by any means, because this is great for mitigation efforts. However, we have to prepare our kids. So how do we do that? How do we talk to our kids about expectations and not scare them, right?
I think when you think about how this all kind of developed, back in March, one minute they decided to start spring break early in certain schools, and then another minute it was virtual. I don't know how, we've all been having these dialogues as adults. I definitely think it's important that we discuss and just have these open-ended questions with our children as to just truly assess how they feel and what they know about, coronavirus, COVID. And then as you get that feedback from them, then I would encourage you to counter and say, well, this is what it's going to look like. I know that you're excited. You're going to see your best friend. You're going to see that favorite teacher. But it's really important for us to explain the whys behind why that teacher may not give you that hug and why that little one may not give you that high five, because some of us are we're just thirsty for that interaction and that socialization. And trust me, I hear it at home. But it's really important for us to simply just have those open-ended questions, ask our children what they're thinking, how they feel, what their thoughts are about going back to school. And then that be your guide to kind of navigate through kind of giving them a step-by-step of what to expect. And more importantly, the whys. Because I think if we tie in the whys, the glitter, the mask, just the kind of the practicing at home, it may kind of lessen the blow a little bit once they get to school.
Yeah, absolutely. We saw a comment a few minutes ago. Stephanie said mask chains are good. I have a mask chain on as well. This is great. If you don't want your kids to put the mask down, they can take it off and let it hang, so it's not going to touch any surface. So this is another one. You can buy them, you can make them, but that's a great tip, Stephanie, so thanks for writing in. Another thing we want to talk about, Lena, is face shields, because face shields made headlines. Some healthcare workers, you do when you're on COVID floors, you wear masks, you wear face shields. Are face shields effective without a mask, one? And two, do kids or educators who might not have a plexiglass barrier in front of their desks need to have a face shield on top of their masks? I don't know if you can answer that, but that's something we've definitely heard a lot.
When it comes to face shields, again, when we're in a healthcare setting, there are a lot of things that healthcare workers are doing that can potentially aerosolize and lift up those droplets. So the actual face shield is serving as a protection for us, as far as not only protecting our face, but protecting our eyes and further protecting our mask. The recommendation for the CDC when it comes to the public is definitely doing the cloth mask for source control, for that barrier. So you definitely want to wear that mask and not necessarily substitute the face shield in lieu of a mask. You don't want to do that. You definitely want to wear that because that is a recommendation. As far as the dual, it doesn't hurt, but it's not necessary. It's not recommended. The mask definitely is what's encouraged.
All right, and thank you so much for everybody that's watching. We're here talking to Lena Puntervold. She's the infection control practitioner here at Joe DiMaggio Children's Hospital. Keep writing in those questions, and if you know anybody that wants to hear this information, you can share this broadcast. You just hit the share button, invite or tag any of your friends or grandparents or parents or teachers or principals that you think might need this information later, and they can watch the broadcast later. Okay, I want to transition because we all know that it is flu season on top of COVID season. And we've heard, there's all different kinds of information about flu shots, but how important before your kids go back to school, and teachers and administrators, is it to get that flu shot this year?
The flu shot's really important. Vaccination with flu is actually relatively low when we look at it from CDC. For the children, it was 63%, so that's really low. Last year, about 188 children passed away from flu, and 80% typically that do pass away are unvaccinated. So think about it. This is a virus that we've all been educated and know about, that it exists, and we have a vaccine. And the compliance has always been relatively low. I know we're waiting for that vaccine for coronavirus, but here we have an opportunity to vaccinate ourselves, not for one that we know is effective, the flu vaccine, and we know that flu circulates as well. So in this particular time where we're still seeing corona, it's really important for us to take this opportunity to vaccinate ourselves for flu, because again, this is one that we know we have a vaccine. It's been around for many, many years, and the compliance rate is low. I encourage you guys to do that, not only for your children, but for yourselves.
I know Broward County has released a school reopening plan, which is very important, I believe, for all parents to read. It's 240 pages. I read it. You can find it on their website, but it's very helpful for you to know and to be educated. But let's say we don't want this to happen, obviously, and we're going to think positive and we're not going to put this into the universe, but let's say there has been an exposure in your classroom, or someone in your classroom that might have contracted and have a positive COVID test. What do parents do? What's the reaction? What's the recommendation from the CDC? Does everybody get tested? Where are we going with this? I think that's something that all parents need to know.
So if it happens, and I hope it doesn't, but if it does happen, I encourage you not to panic. Remember, there are other viruses that are currently circulating in the community. So if there is a suspicion for a potential person or student that may be positive, again, they may have the sniffles, they may have had a fever, I encourage you to just pause and just wait. Coronavirus has infected pediatrics, and we have seen our share of coronavirus, but these children do, recover. They recover and they do well. So if you find out, I would encourage you to just monitor your child. If you want to take daily temperatures, absolutely take temperatures. In the event that your child were to exhibit any kind of symptoms, I encourage you to call your pediatrician and then work through it that way. I know that this is a lot. I know that, you hear that and that's the last thing you want to hear, so I hope you don't. But I encourage you to just pause and remember there are common colds. Influenza season is about to start in addition to coronavirus. So we just really need to just watch our kids and then work closely with your pediatrician.
Lena, as people decide if they're going to send their kids back, because I know the date changes and a lot of people might have accepted a seat, but they're not sure if they're going to send their kids. I think it's helpful as we wrap up to maybe share your perspective on where we are with COVID right now as a system here at Joe DiMaggio Children's Hospital. Are you seeing things decrease? What are you seeing? That would be really helpful, I think, for parents.
So Joe DiMaggio, we did see a spike during the summer. We did see a couple of children trickling in through our ED. Some children did require some admission, but again, they all did beautifully. They all went home, and they're now home, I'm sure, driving their parents crazy. As of today, as of last month, we have seen a nice encouraging decline in our numbers. We take it day by day here at Jody, and we definitely embrace things as they come along. But right now, the numbers are cautiously, or they're encouraging. So they are dropping, and we're very happy for that because the community seems to be at a decline right now with pediatrics.
All right, well, we know that you're very busy. Lena starts her day, you guys, at 6 a.m., works 10, 12-hour shifts, so she's very busy. So I want to thank you for providing all the feedback. If there are any other questions, we will ask Lena that are in the comments and get back to you and respond if you guys have any other questions. But thank you so much for watching. Thank you, Lena, for giving us so many helpful tips. And remember, the website, JDCH Hospital, has so many resources and blogs, and all of our social media channels. We're putting out so many tips. So please, if you need any resources, come to our social media pages, come to Instagram, come to Facebook, and come to our blog, and let us know how we can help you. Thank you so much for watching, everyone. Good luck returning to school. We're with you. Come on, Lena, say bye to everyone.
Bye, guys.
And happy Friday, everyone. Thank you so much for watching. Bye.